I'm Dr. Abdullah Zakaria. Today we have Dr. Annie Murphy, who is a GP and a digital lead for the South West London NHS services. Hello, Dr. Murphy.
Hello, and thank you for having me on.
So today we are going to discuss a very important topic, which is how to optimize the access to the NHS services in the UK. Mainly in England, as you know, the health is a devolved matters in the United Kingdom. Now, to make it a simpler way to discuss, my first question would be, or maybe if I can replicate from my patients, that I don't get to see you. It's difficult to get to see a GP. What do you say, how do we explain that this difficulty that patients are having? What can they do?
Yes, thank you for the question. And I completely understand the frustrations that people have when they are trying to access GP appointments. And believe me, GPs really want to see people and to really help people in the community. GP practices are working really hard to try and improve access so that people can have the care that they need when they need it. GP practices have grown and evolved over, the last few decades from what it used to be, which is just a single-handed GP who knew your community really well, to rather larger organizations with a multidisciplinary team with lots of different clinicians and staff that have different expertise who can help you better for your query than the GP sometimes can. So people like clinical pharmacists, paramedics, and advanced nurse practitioners will be able to care for your particular needs better sometimes than a GP. So it's not always the case that you need to just see a GP. There are many professionals you can also see. And so we're working hard to try and improve access for everyone so that everyone, when they phone or they go online to try and book an appointment, they should be able to get to the answer that they need in a timely manner.
Can you tell us, of course, when we encounter any appointment or telephone appointment, shall we say, 5 years ago, before pandemic, we usually don't have many telephone consultation or video consultations. Now, the consultations are different types now. Can you tell us a little bit about that as well?
Yes, absolutely. Certainly, the ability for you to access information has changed a lot over recent years, particularly with more things going digital. So you can still walk into the GP surgery and interact face to face and have face to face appointments. But there are also other options available, such as online consultations, where you can submit an online form asking your query and you should get a response relatively quickly, usually within 1 to 2 days, as opposed to having to wait for an appointment. If it is something that is a simple query that can be answered online, then that is a definite option. There are also telephone appointments and video appointments where the clinician can contact you and allow you to click on a link so that you can see them virtually via video. So all of those modes of access are designed to help people choose what is the best thing for them. It doesn't mean that you're not going to get any face-to-face appointments, but it's designed as an adjunct in addition to support what else you might need.
Right. Thank you very much. Now, that leads to the question of when a patient is deciding what type of consultation they want to do or where they want to go. As we know, in the National Health Service, we have two front doors. One of them is in the hospital, known as A&E, or now we know it as an emergency department, or ED. The other one is general practice. Now, when people should go directly to A&E and when they should actually call their general practice?
Yes, so A&E, as its name suggests, is accident and emergencies. So if you have a life-threatening emergency, things like losing consciousness, chest pain, as if you're having a heart attack, strokes, difficulty in breathing, severe bleeding that won't stop, or if you've had an accident, when you're having fits, seizures, or suddenly feeling confused, and things like severe allergic reactions and burns. Those are the things that you need to go to the emergency department for. For other things, if you're unsure, you can contact either your GP practice or NHS 111. And the idea is they will ask you a series of questions designed to understand what your query, what your problem is, so that they'll be able to signpost you to the correct health professional who can then deal with your care at the right time. So that's why it's really important to answer the questions that's asked by the call handlers, because it's all designed to assist you in finding out which is the right care pathway for you.
And in addition to this, there is also an online algorithm that you can interact with to find out where to go. We know this online consultation, there is a system. If I'm unsure where to go with my problem, if it is an emergency, of course, call 999 and we can come to that in a minute. But if it is not emergency, it's something that you are unsure where to go, you can interact with the online consultation methods. And do you want to expand on that? And I know different practices may have a different modalities of their, different software they use. Locally, we have different providers. Do you want to expand a little bit about it?
Yes, absolutely. So there is, as you may be aware, the NHS app, which is available to everyone to access NHS healthcare and services. So with the NHS app, you can look up health information. You can contact your GP surgery using an online consultation tool, which is basically an online form. You can also order your repeat medications without actually having to turn up to the surgery and fill out multiple forms. All you need to do is on the app, you just tick what you need, and you should get that delivered straight to your pharmacy. The other things you could do is look at your medical records. So if you wanted to see what's happened to you in the past, any previous hospital letters related to you, you can access that via the NHS app. And you can also look at your test results. So if you've had a blood test done and you want to know the results, that's another thing that you can look at. And with online consultations, not only can you access it from the NHS app, but the GP practice websites will also have a link to be able to submit an online form and then get a response to your query.
Okay. So while you were talking about this online access, I was thinking about what are the other benefits, like, let's say, for example, some practices may or may not allow to book appointments. So some people easily get sort of disgruntled. Okay, this NHS app is no good. But in terms of NHS app, is there any other app that is available or any other way people can access their information?
Sure, yes. I mean, every GP practice will have slightly different versions of access, and they may have different systems that they use. Some GP practices offer the website as a point of call. So if you have a query, you can fill out a form on the website. The website can also signpost you to the relevant health information that you need. Other practices may also use the EMIS version of the NHS app, which is very similar, and it also allows you to book appointments and view your records in very similar ways. In some of these apps, they also link in with community services. So there are certain things where you can actually self-refer. You don't need a GP or a clinician to refer you. So things like physiotherapy, for instance, in this area, it's a self-referral service, as well as some of the counselling services and mental health services. You can also access information via the apps on how to access them and how to get the support you need yourself.
Right. Thank you. I just wanted to add another point. Like when you are navigating different service provider within the NHS, let's say you are consulting a mental health provider or acute services like in the hospital, sometimes we see that when you are traveling to different parts of the borough or different parts of the city, they may not have all the information. But if you have a handheld, like your mobile phone with the access, then you can immediately, they ask what are the medications you are on. you may not be able to remember all of your medications, but you can show them these are the medications you are taking, pretty much every information that to your fingertips. I think this is another advantage that while we are we're navigating the system, people may not always get all the information in front of you, but you can really assist your clinician by providing accurate and up-to-date information if you have any of those apps in your mobile phone, right?
Yeah, I mean, that's exactly it. I mean, there was one of the junior doctors once told me in a workshop that they used to work in A&E, and they used to have people coming in with health conditions, but they lived further away. However, the patient themselves had access to the NHS app. So whilst the doctor couldn't find out what's on their repeat medication, the patient themselves could bring it up and show the doctor. So you're helping in the decision-making process of your care, and that can only be a good thing.
Now, we started our program by asking the complaint that we normally receive from our patients, that why can't I get to see my GP? Another very commonly receive, shall we say, feedback is, well, I'm on the phone with my GP practice. I'll be on the phone for probably an hour before I get to speak to someone. What would you say? How can we get round to this?
Yeah, that is definitely a common frustration that I hear quite regularly. And we are trying to address this in many ways, really. The first really is to think about all the other ways you can access the GP practice, not just via the phone. Everyone automatically picks up the phone and calls, and if everyone calls at the same time, there is a bottleneck. And the call handlers, who are our care coordinators, in order for them to understand what is the correct pathway for you, we'll have to ask you some questions. So that might take a little bit of time. And so that may end up being a wait. You could shorten this wait if you wanted to by going online and filling out the online consultation form instead. And that means you can do it in the comfort of your own home, at your own pace, at your own time, without being rushed. And then you will get a response relatively quickly. So that's one way of doing it. Although, it's really important to ensure that we have the ability to offer different ways of access, certainly for people who are less digitally able, who have some particular needs and extra special needs. So, of course, the practice is open to other people directly, just by walking in as well. But if you are able to access the digital apps and online consultations, it may actually speed up the process of obtaining care.
Absolutely. I'm just thinking of, like 20 years ago, we used to go to the bank for our regular banking. So now hardly people go to the bank for regular activities. Even the bank checks can be now taken a picture and deposit easily. So it's not entirely possible to do everything digitally. I understand that, but quite a few of our patients will come to us which can be done digitally. Say, for example, someone is asking for the information or medication, repeat medication, or they are going away and they need some travel advice and so on. So thank you very much for that. Now, I'm just going to come to my next question, which is related to a bit more information about NHS 111 service. Can you tell us, I know that when the GP surgery is shut in the evenings or in the weekends, people usually mainly call NHS 111. What are the link of this service with your GP practice? Can they actually talk to the GP practice and sometimes can book appointment as well? We know that. Can you tell us a little bit about that as well?
Sure, yes. We talk about the front door to NHS services, and I would say that in modern NHS services, 111 is probably one of the main front doors. You can access it in a number of ways. You can simply dial 111, or there's also the online option for 111, which you can go via the nhs.uk website, or even on the NHS app. So there are many ways of accessing 111. And the idea is the call handler or the algorithm will ask you certain questions about what your problem is, and it would look for red flags or signs where it will need to send you to emergency services. But other than that, it would then be able to collate the information you give and then signpost you to the right service for you. It might be the GP practice, or it might be the local pharmacy, because local pharmacies now have what is called the Pharmacy First service. They can deal with a number of conditions for you. You not necessarily have to wait for a GP appointment. So you can get treatments for urine infections, sinusitis, amongst other, like ear infections as well, amongst other conditions. And you'll be able to...
Sore throat and so on.
Yeah, sore throat. And, yeah, exactly. And that they can deal with a lot more for you, and you don't have to go through all the wait.
Absolutely. So the Pharmacy First is as an initiative in England, and I suppose not every pharmacist, but most pharmacists, you can find them by Googling or going online, or you can ask your GP practice. Our receptionist, we call them care navigators, they are able to take information and can refer you as well if you find it difficult. And the referral will go to the pharmacist, and pharmacist will call you back. And the simple minor illness they can see, give you advice. So the idea is not to deflect you from general practice or from the NHS service. And all of these are NHS services anyway. The idea is to, if the minor illness can go and see pharmacy first, then you can free up some of the time to see other complex patients in the general practice. Now, I would like to ask this question, although it's not entirely related to the digital health, but in terms of the chronic disease management that we have, like loads of our patients are known to have a diabetes, heart problems, stroke, or let's say epilepsy, and so many, or mental health condition. And we actually monitor them over the year. And there are certain things that we have now, we've been using, like a questionnaire or let's say home blood pressure reading, that we ask our patient to do it at home and then send it through. They monitor it at home, and it is really, really helpful for, recording the accurate blood pressure reading, because when they come to the surgery, they may be rushing or anxious. We know white coat hypertension, and their blood pressure is not accurate. So there are other modalities like for mental health, for, other tests that we do, or questionnaire we do, like for asthma. So how can you explain this digital innovation that 10, 15 years ago we never had? Now we have all those modalities. I wish I could discuss the AI here, because AI in our system is prompting those, but we are sending this information gathering exercise, asking our patients to involve or getting sort of charge of their own health. Could you tell us a bit more about that and why we should be doing it? And it's not passing the buck, it's actually getting involved in your own care.
Yeah, I think just to go back in time, just to paint the picture in the past, really, like decades ago, we didn't really focus too much on managing long-term conditions. We were quite a reactive service in the NHS. We're only dealing with problems as they arise. And it's only in recent decades where the evidence has come out that it's really important to manage your long-term conditions such as diabetes, etc., just because of the complications that can arise if they are badly managed. So, you can, if you have badly managed diabetes, you can be at higher risks of heart attacks, strokes, etc. And the implications of treating that is worse than trying to prevent it. So it's really important to monitor your long-term conditions, and that's the reason why we ask you to do it every year. And the fact that there's been new digital technologies that help you manage your own health, collect your own data and information like blood pressure, etc., will really help monitor how you manage these conditions. So it's us managing it jointly with you as the patient, and we need to work together on this. And because now you are able to collect your own information to assist in your care, that makes the process a lot more efficient and productive. So when you do come to see the clinician for your planned care appointment, we've got all the information we need to be able to make a decision on whether to change medication or not, or what lifestyle changes are useful for you. So, these digital tools aren't meant to replace, but they're meant to enhance, so that all the information you can give via the digital tools will help the decision-making process and will improve your care.
Excellent. So I'm just thinking, when you are answering this question, really about 10, 15 years ago when I started general practice, remember at that time that we used to send letters to patients' address. So now this has been entirely replaced by SMS. So we communicate with our patient, largely 90% or plus patients sort of respond to their SMS. And there is a two-way SMS system as well. You can collect information. You can put your blood pressure reading as reply of the SMS so that it goes straight to your system. Could you tell us a bit more about that? This is all new innovation. It's happening over the last 4 or 5 years, maybe.
That's right. I think this has really kicked off since COVID, actually. Prior to that, you're right, we used to just send out letters and they got lost in the post, or people never opened them, or people moved house, etc. But since the advent of text messaging and email as a means of communication, that's really revolutionized how you can have almost a conversation with your clinician. So you can send a message in, they will respond and allow you to send a message back. So it sort of improves the experience of you being able to get information and care. So I think this is a great thing, and I hope this continues further, and to be able to enable more conversations between the clinician and the patient.
Absolutely. That's brilliant. I mean, there are certain screening program going on at the moment. We know national screening programs where GPs and primary care really encourage our patients to participate. And main modalities that we communicate is now through text messages. Now, if, let's say, for example, 95-year-old lady doesn't have access to the digital system, what would be the answer for those patients? We know about the proxy system. Somebody else their carer can do it. Can you tell us a bit more about that as well, so that we don't really deprive them from this innovation?
Yes, absolutely. That whenever we talk about digital, there's always the question about digital exclusion for people who have, who don't have the inclination, who just simply can't access digital services. Now, for those people, there's something called proxy access on the NHS app and other apps, which means that their carer can have access on their behalf with their consent. So if you are a carer for your elderly relative, you should be able to access your relative's information by proxy. Same thing applies if you are caring for your children, for instance, because the NHS app is not available for children under the age of 13. So parents will be able to get proxy access for their children. And I know many parents who really appreciate that, because they can check the immunization status of their babies and they know when to bring them in for their vaccinations, etc. So it is really a useful tool and can be accessed by proxy, and that would really help improve communication channels as well.
And accessing the services and so on. Thank you. So last question, we're right at the end of the program. Last question is related to another charge that we have. Usually we hear from our patients that we call ambulance, but they didn't turn up. Can you tell us the different categories of the calls that people make to the ambulance, and actually what are the targets for the ambulance services to response? Because we know there are certain things are emergencies, and some of the other calls are not categorized as an emergency. A little bit about this. I mean, I think this is another question we encounter regularly.
Yes, that's a really important question to ask, because often it's a misunderstanding leading to expectations not being met and people being disappointed or frustrated. So for ambulance services, there are categories of response times from 1 to 4. Category 1 being the worst, most life-threatening injuries or illnesses, such as a cardiac arrest, which is when the heart stops beating, or people lose consciousness, or a major road accident where you've got serious injuries. And the response time for category 1s, like this is, if they don't respond and take the patient to hospital, the patient will die. This is a category 1, and the response time is about 7 minutes is what they aim for. Category 2 is for emergency medical situations such as heart attacks, strokes, or some severe burns, etc. That is really serious medical emergency, and the ambulance will aim to respond by 18 minutes. Category 3 is less urgent but still severe, serious medical emergencies. But because it's not as life-threatening, the ambulance aim to respond by 2 hours. And category 4 is a 4-hour waiting time. So it depends on when you call the ambulance and the symptoms and problems that you're reporting. You may be put into one of these 4 categories, and the response times will vary depending on your medical need.
Thank you. So it's nicely explained different response rate or aim. Different areas of the country may have a different level of response time in practice, but these are the targets that we know that the ambulance services should provide. So we have been, discussing quite a lot actually in terms of the access, so how to access ambulance services, how to access GP services, and how to access the emergency department, A&E. And also the digital way of accessing those services whenever is appropriate. Thank you very much. This brings us to the end of our show. I would like to thank Dr. Murphy, my team, and the listeners.